Hi, everyone. My name is Ashlyn Jose, and today my presentation is going to be on an article that was published by the Portland Community College, and this has to do with an exchange forum that people write articles and their different journal articles posted for the benefit of the healthcare industry community. And this particular article was written in 2016, and it revolves around how how effective healthcare communication can really save patients' lives. So you know, a lot of different aspects of healthcare were looked at when they were looked at the study. They were looking at the communication between patients and doctors, as well as doctors internally within the team, to nurses or other parts of the team as well. And it really came down to a couple of main points that they wanted to bring up. So the question really is, who will be there in a patient's surreal times to support them? Now, many patients handle things very differently when it comes to whether if it's some sort of chronic disease or whether even if it's a short-term pain. A lot of people have different sort of pain points. A lot of people have different things that they're able to handle. And one of the things that this article really touches on is who is going to be there for them. Well, number one, it really needs to be the support system that's at the hospital already, because it's very important that they feel that they're in safe hands. And number two, it also needs to deal with the communication externally. It has to do with the patients, how they talk to their families, what the families say to them. And there's a lot of studying, and there's a lot of different aspects going about in order for someone to really truly understand what can be done. So a couple of things that are really important. Number one is active listening. It's important that the patient understands that not only are you listening and just hearing what they're saying, but you're also understanding why they may be saying it. This may include follow-up questions, your tone of voice, just the way that you're sitting, or the way that you're taking notes. These are all little things that may not seem as such big deals, but to someone that is being talked to, or even if it's a patient or whether it's not a patient, they look at these things to understand what is that person thinking when I'm saying something. And it's very important, and it's something that not only in healthcare, but can also relate to business when you're sitting around the conference room and you're making deals or you're making decisions. Body language is just as important as what you actually say that's coming out of your mouth. Non-judgmental attitude. This is also another main point that is really needed to be honed in and understood, because sometimes people come in and you'll see patients that for example have a lung disease, or they may have something else that there is a good chance that they self-inflicted because of certain things like smoking, or maybe they have liver disease from alcohol. And one of the main things that really comes to play here is being non-judgmental, understanding that, look, maybe you don't understand why a person had to do it this way, but it's not good for a patient to come into the room and a doctor to already say some things about, why were you smoking? Why were you drinking? Things like that. The point of the matter is that someone already has a disease, they're coming to you for help, and it's important that you stay non-judgmental throughout the process. So a couple of things that have been implemented. Number one is really kind of looking at the different chain of events for a patient within a hospital system, and understanding where are the cruxes where communication issues happen. And the number one crux right here for most individuals, when we're talking about especially the New York City area that they've done studies on, is the fact that when a nurse is changing shifts and there is a change from one nurse to another nurse and taking care of a patient, there's about a 10 to 15 minute overlap between their shifts. And between these shifts, between this time and this 10 to 15 minutes, the first nurse is giving all the information they can to the second nurse about the patient and what their status was over the last 8 to 12 hours and what needs to be done in the future. Now, there's been a lot of studies that show that this exchange of information is not very accurate. There's a lot of things that are left out, sometimes because of time constraints. You can imagine someone needs to leave their shift while someone is just getting into their shift. And both of these individuals are not in the right state of mind at all times, to be fully alert and to be fully aware of what's going on. So there are different computer programs that health informatics specialists and other software programs that are really revolved around this information exchange. Now, some best practices to implement that we're talking about here when someone is deciding to listen and to understand what's going on in a situation. Number one, you have to plan for different type of personalities. You know, not everyone is as understanding, not everyone is as educated. Even certain terminology. You know, if you want to tell somebody that if you do something, they're going to have a slow heart rate, and you use terms like bradycardia instead, or you use different type of medical terms. Not everyone understands. That is a huge role, because if someone doesn't understand something, that may lead them to be frustrated, that may lead them to be angry, that may in turn kind of play into the issues that may happen during the time of the visit. Another thing is be empathetic. I know sometimes when the shift comes to an end, or you see patient after patient after patient, it's difficult always to empathize with everyone. So it's important to stay empathetic for all patients alike, and treat that patient like he or she is your only patient, so that they really feel like your full attention and your full care is on them at all times. Using active listening skills, like as I mentioned before, taking notes. This is something that even if there's just a couple of notes, if you have a notepad out, if you have a pen out, and you're really kind of taking notes, and they understand that this is very important, whether it be from your boss to you, or you to your boss, or whoever it may be, you'll see when you really notice this that a lot of people do take time to take notes, and it really shows that they're actively understanding and actively paying attention to what's going on. And finally, just being direct, clear, and open. There's a lot of times that there may be an issue at hand, and someone is just kind of going out and just talking and talking and talking. But what you can really do is just be concise and be clear with what's needed. So I do have a couple of discussion questions that we can talk about here. And I just wanted to be, so what are some active listening skills that you use in your own time, whether it be that you're the listener or you're the talker? Name a situation that maybe you could have had better communication to handle it differently. And have you had a situation with a difficult patient or coworker that you weren't able to use communication skills effectively? Thank you for listening.